How does primary care integrate for bipolar health? Imagine walking into your primary care clinic and finding not just a doctor who treats your physical health, but also someone who helps manage your mental health. That's the essence of integrating bipolar disorder care into primary care settings. Because many people with bipolar disorder see their primary care provider more often than a specialist, this integration makes treatment more accessible and less stigmatizing. It's about creating a team effort that combines mental health support with general medical care to help people live healthier, more balanced lives. One of the main ways primary care helps with bipolar disorder is through collaborative care models. These models are recommended by clinical guidelines and involve a team that works together to support the patient. The team includes primary care doctors, mental health specialists, nurses, and care managers. They use evidence-based practices, support patients in managing their symptoms, and regularly check progress with standardized tools. This approach helps catch symptoms early, monitor mood swings, and adjust treatments as needed. Screening is a crucial part of this process. Primary care providers use validated questionnaires like the Patient Health Questionnaire 9 to screen for depression, and tools like the World Health Organization's Composite International Diagnostic Interview to identify bipolar disorder accurately. Since bipolar can sometimes be mistaken for depression, early and correct diagnosis ensures that patients receive the right treatment from the start. Care coordination is another key element. The primary care provider often acts as the hub, communicating with psychiatrists, psychologists, and community support workers. This team-based approach helps manage the complexity of bipolar disorder, which often comes with other issues like anxiety or substance use. It also ensures that everyone is on the same page about treatment plans, medications, and safety concerns. Speaking of medications, primary care providers work closely with mental health specialists to manage prescriptions safely. They consider interactions with other medical conditions and involve patients in shared decision-making. Regular communication helps make sure medications are effective and tolerable, reducing side effects and risks. Risk assessment is ongoing in primary care. Providers regularly evaluate for suicide risk and other safety concerns, especially during severe episodes. If necessary, they refer patients to psychiatric specialists for urgent care, ensuring safety remains a priority. Addressing barriers like limited mental health resources or stigma is also part of integration. Embedding mental health expertise within primary care makes it easier for patients to access help without feeling judged or overwhelmed. This approach helps reach people in diverse communities and practice settings. Research shows that this integrated model improves health outcomes, increases patient satisfaction, and can even reduce costs. When psychiatrists provide consultation to primary care teams, it enhances the quality of care and supports better management of bipolar disorder. In summary, primary care integrates bipolar health through structured, team-based approaches that include screening, accurate diagnosis, coordinated treatment, medication safety, and ongoing safety checks. This model recognizes the complexity of bipolar disorder and aims to provide continuous, accessible, and patient-centered care within the familiar setting of primary care. Always remember, for personalized advice and treatment, consulting healthcare professionals is essential, as every individual's experience with bipolar disorder is unique.